Yeah, I think it's going to be both, but probably the second one, the targeted therapy revolution, if you like. So as I indicated at the beginning, chemotherapy traditionally was based on tossing things in and seeing what worked, what killed the cells. Now we're beginning to understand in molecular detail what's driving oncogenesis, as Dr. Safar talked about various oncogenes and things like that. It seems like we've already, the genetic code has already been done. We've probably discovered all the proto-oncogenes. These are genes that are driving cell proliferation. We've probably discovered all of them now. And we have some real good abilities now to block the function of some of these genes in a very specific way. So in lung cancer, for example, one of the key drivers is a receptor on the cell surface called the epidermal growth factor receptor. And we know that's very important in lung cancer. And now we have some drugs which specifically target that particular receptor and stop it working and stop the proliferation of those cells. We have all kinds of other examples, like in chronic myelogenous leukemia, where there are certain enzymes and proteins that are specifically made in cancer cells that we can now make drugs to and inhibit the function of those particular proteins and enzymes. So I think we're going towards the targeted therapy, but that doesn't exclude identification of new natural products that might come along that might be very effective. And I think in general, one drug typically doesn't do it. We need to use combinations, as you know. And I think various cocktails of conventional drugs and targeted drugs is really on the horizon now and is already beginning in many different ways. And because there are so many drugs out there, there's just a lot of different combinations that can be tested. And one of the problems is it's difficult to test so many drug combinations in patients. You just don't have that opportunity. And so this is why it's important that we continue to do basic research so that we can really start trying to sort out which drug combinations may be the best way to go. And that's actually some of the work that we're trying to start right now in my lab.